Do you ever wonder if all your patients' medicines are still needed? Are you frustrated that guidelines often tell you when to start medicines, but rarely when or how to stop them? Do you sometimes feel uneasy continuing a medicine when the benefits are no longer clear? Or stopping a medicine that someone else started? I felt the same until I began taking deprescribing seriously. I always thought deprescribing would be hard, but with the right approach, it's easier than I expected. That's when I started to feel like a deprescribing superhero. All I had to do was bust the 5 myths that used to get in my way. The first myth was, my patient's current medicines are probably fine. My patient hasn't had any problems yet, so if it ain't broke, why fix it? The truth is, when we prescribe or deprescribe, we can't be certain if there will be benefits, adverse effects, or more serious harms, like falls or death. Was I really going to just wait and see? Enter myth 2. If I deprescribe, won't my patient's symptoms return? This is only true if the medicine I'm deprescribing is actually helping, which isn't always the case. That's why I often substitute with a safer, evidence-based alternative. Speaking of safety, myth 3 suggested there was no evidence that deprescribing can be done safely. False. There's lots of evidence from randomized trials showing just that. Deprescribing certainly makes far more sense than continuing a medicine with limited or no benefit when safer alternatives exist. There are evidence-based algorithms to guide deprescribing for a range of medicine classes. Myth 4. My patients don't want to stop their medicines. Well, that proved false too. I guess I'd never really asked them. It turns out over 80% of older adults said they'd be willing to stop a medicine if only their doctor asked them. Once I knew that, I had every reason to deprescribe. The only myth left was that I don't have time. Well, randomized trials have shown that providing written information is a simple and efficient way to engage patients and start the conversation. So as you can see, with the right support, including tools and an individualized approach, I was able to bust the myths. I now fit deprescribing into my everyday practice. What's stopping you? Are you ready to join the Deprescribing Superhero League? Because reducing unnecessary medicines reduces risks, and that's safer medicine. For more support with medication deprescribing, explore the Support Meds website and resources.